This is Beat Depression, the book by David Hinds from 2001. Chapter 4, What Can the Doctor Do? Healing is a matter of time, but it is sometimes also a matter of opportunity. Hippocrates, 460 to 377 BC. The bottom line, consult the professionals, visit your doctor. What can the doctor do, you might wonder? If you are seriously depressed and have yet to contact your GP as recommended in Chapter 1, the chances are that you are not wondering at all. You are soldiering on in bewildered isolation under the mistaken impression that your troubles are yours alone. This most unfortunate state of affairs is confirmed by the health department in the UK. Their figures show that only 1 in 2 people with depression consults a GP. Before I tell you about what the doctor should be able to do for you, please go ahead now and telephone the surgery for an early appointment, or allow someone to make the call for you. I am urging you to do this without further delay because I want you to be in a position to touch and enjoy the benefits that I am going to outline in Chapter 6. Doctors' schedules being as they are, it is possible that you may have to wait a few days for an appointment. Do not allow yourself to be dissuaded from seeing your doctor by people who do not understand the complexity of depression. At a recent conference in London organised by the National Depression Campaign, it was revealed that the overwhelming view of the lay public is that their relatives' or friends' depression is the result of money problems, bereavements, or illness in the family, work, or relationship difficulties. The importance of the underlying physical problems that render a patient vulnerable to these trigger factors have been seriously underestimated. Women, more than men, realise that an abnormal biochemical or hormonal balance may be the underlying root cause of the patient's depressive state. These days, doctors usually have a range of treatments at their disposal, including medical treatment with antidepressants and talking treatments comprising cognitive behavioural techniques, interpersonal care, and problem-solving therapy. The term talking treatments is a general umbrella for all therapies which treat depression by exploring what it was that made a person depressed in the first place and what it is that is keeping them depressed. It seems probable that the more severe forms of depressive illness are associated with chemical changes in certain parts or pathways of the brain. These changes are believed to vary according to the different forms of depression. Whether or not these chemical changes are the cause of depression, rather than one of its consequences, is not known. However, correct medical diagnosis and a sustained course of treatment with antidepressants can normally be relied upon to make good any biochemical abnormalities in the brain and to restore the patient's normal or perhaps a greater sense of contentment with life in general. Typically, antidepressants take a week or two to take effect. Although many people who respond to antidepressants begin to feel better soon after the commencement of treatment. Contrary to popular belief, they are not addictive. The Depression Alliance, a British charity offering practical guidance and help to the depressed, makes the point that the most important partnership in medicine is the one between doctor and patient. Partnership in this sense means trying to give your doctor as much information as possible about how you feel so that the doctor can understand your situation properly. This can be difficult when you are feeling depressed, and the following ideas from the Depression Alliance's booklet entitled A Guide to Help You Through the Misery of Depression are ingeniously thought out and very practical. Preparation for your visit to the doctor. Before you set off for your doctor's surgery, write down how you are feeling. This will help you to remember important points and will also help your doctor get a clear idea of what your symptoms and feelings are. Sometimes it can be helpful to go to your appointment with someone you trust. You may be feeling very fragile and therefore be unable to concentrate on everything the doctor tells you. Mention your most important concerns and symptoms at the very beginning of the consultation. If you feel you might clam up, especially if your doctor seems a bit scary, write him or her a letter ahead of your appointment explaining how you feel. On the outside of the envelope, clearly mark the words "concerning my appointment," followed by the time and date of your appointment to see the doctor. Be more concerned about your own feelings than the doctor's. If you are feeling pretty grim, say so. If you don't, you may never find out how sympathetic, supportive and informed your doctor can be. Follow-up is very important, and you should always ask your doctor if and when you need to see him or her again. After your appointment, you may begin to feel a little better straight after your appointment as a direct result of doing something positive about your condition. In the unlikely event that you are less than satisfied with the consultation you receive, don't hesitate to tell the doctor's receptionist, the practice manager, or if necessary, your local health authority. They may suggest that you see a different doctor. When you are completely recovered and life is a joy once again, or for the first time in a long time, if you had forgotten what it was like to feel joy, spare a thought for your doctor and the level of service you received in your hour of need. Doctors can get depressed themselves, and the occasional letter of recognition or thanks for exceptional service, if deserved, goes a long way to compensate for unsociable hours and the hazards of the medical profession.